All right, what's up, peeps? Let's talk about front rack position, all right? So my CrossFitters, my weightlifters, just everyday people, if you wanna hold stuff in front of your body right through here, we wanna be able to get into this, what we call a front rack position with a barbell or dumbbells. What most people look at, you wanna come over here, is they struggle with the front rack. So if you're doing front squats, shoulder to overhead or anything like that, what tends to happen is we get this barbell out here. And we're kind of bouncing around when we do our movements instead of letting it relax on our shoulders up here. If it relaxes on our shoulders, then we can drive off our shoulders and we can keep that weight over our center of gravity while we do squats and things. Now, how do we fix this? What most people do is they grab a band or they grab something like a ring and they're going to do this number, which this stretches out your lats, okay? Great. Because you need lat mobility to get in a good front rack position. But I'll challenge you right now, if you're watching this video, do this for me. Can you do it? You have enough lat mobility, all right? So if I can put my elbows up here, I should be able to put them up here, right? What most people lack is actually external rotation of their shoulder. So they're holding that barbell with their hands inside or right in front of their shoulder. And come up here like this, and their elbows are outside of their hands like this, so there's no place for their elbows to go up without this bar going out. So we actually, Sarah, if you want to step down in front of me, we actually want to get a little bit wider grip on this barbell so we can send our elbows through and let our hands be outside of our shoulder. If we can grip a barbell and have those elbows on the inside, shoulders on the inside, hands on the outside, then we have a good front rack position. So what do we need to do? We need to stretch out these rotator cuff muscles into this external rotator position as well as your chest. So hop over here. We're gonna find you a corner. If you've been a patient of mine, I've probably showed you a corner before, not because you're in trouble, just because this is a good tool to have. Most of the time too, a corner is hard to find. So find a bare corner in here. What we're gonna do is we're gonna put our forearms up on the wall, palms up here, and we're gonna lean in into this wall, making sure our back doesn't arch, okay? So we're gonna stick our booty out, lean in, keep your elbows on the wall, go as far as you can, hold in that stretch for about 1.5 to 2 minutes. You wanna do a little bit extra? Do about 10-second hold, and then push into the wall for 10 seconds, contracting everything, and then relax into it again, and again, and again. That's gonna do well in stretching all this out. Another one that you can do is you can grab your PVC pipe, kind of work your arm into this external rotation position, into there, and then we're gonna come back up to our barbell, get a little bit wider grip. You wanna come over here again? Then we're used to having, then we're gonna step up, put that barbell on our throat, elbows up, hold like this. A good test to know if you have a good enough mobility for this good front rack position. If you can do a front squat with a full grip on the bar and go all the way down and all the way up without your elbows moving, you got it. All right, try it out, retest, make your lifts better, make your squats better, make your overhead better. Use your function. Don't try to work on something that's not working for you.